Hi learners, welcome back to my YouTube channel Psychology Globe. I hope you all are doing well. So today we are going to discuss the second kind of psychotherapy and one of the most widely used therapies, the behavioral therapy. The behavioral therapy assumes that the psychological disorders or problems they arise or occur due to faulty behavioral patterns or thoughts that are learnt by an individual, and the main aim of the behavioral therapy is to identify these patterns and replace them with desirable patterns using certain behavioral techniques. For example, there is a child who shows very aggressive behavior. This aggressive behavior is due to watching violent movies. So the therapist makes the child watch peaceful movies and also rewards the child for displaying peaceful behavior. In this manner, faulty behaviors they can be replaced with desirable behaviors. So before we jump on to learning the methodology of behavioral therapy, we need to understand one thing, that behavioral therapy is very vast and very dynamic. It treats meager issues like certain phobias to major psychological disorders like depression and anxiety. So although the basic methodology for behavioral therapy remains the same, but the behavioral techniques that are used, they can be very different. So let's understand the methodology of behavioral therapy. The first step in behavioral therapy is recognizing the antecedent factors of the behavior. What are the antecedent factors? Antecedent factors are the factors or the causes which are responsible for making a person indulge in certain kind of behavior, and then the therapist identifies the maintaining factors. The maintaining factors are the ones that lead to the persistence of a certain kind of behavior. For example, there is a child who has started smoking. Now smoking, it is the undesirable behavior, and he started smoking because of exam stress. So exam stress becomes the antecedent factor. And let's say that particular child is continuously smoking because of the relief that is felt after smoking. So the relief felt, that becomes the maintaining factor. Now certain antecedent operations and consequent operations are applied to treat undesirable behavior. Antecedent operations are the ones which are involved in changing the situation before the behavior, and consequent operations are the ones that change the situation after a particular behavior is displayed. For example, if there is a child who doesn't have dinner properly, so this becomes the undesirable behavior. Now what could be the antecedent operation? Antecedent operation is could be feeding that child with very less food during the snack time, and consequent operation could be rewarding that child with a candy or chocolate after finishing the meal. This will lead to establishing a certain kind of desirable behavior. So now I am going to discuss some prominent behavioral techniques that are used by behavioral therapists in order to treat faulty patterns. The first technique is positive reinforcement. This is a very common technique and is used by many of us in daily life. Let's say if a child does not do homework properly, so whenever he or she does it, the mother can feed the child with his or her favorite dish, which will make the child habitual to doing homework properly. And even if after the positive reinforcement is suspended, that behavioral pattern will be established in such a manner that the child does not need positive reinforcement in near future. The second technique is token economy. Now token economy is quite similar to positive reinforcement. It only differs in the sense that the positive reinforcement, it is not introduced immediately. This technique is basically used in schools and colleges. For example, if the child gives all his or her presentations in a very great manner, then the teacher gives them certain tokens which can be exchanged for a prize at the end of the session, which could be a book or a canteen treat. The third technique is differential reinforcement. Differential reinforcement means when you use positive and negative reinforcement in one similar situation. For example, if there is a girl who cries a lot whenever she is not taken to the cinema, her parents are instructed that they are supposed to take the girl to the cinema when she asks for it peacefully, and they are not supposed to take her when she cries. The fourth technique is systematic desensitization. So this technique was developed by Wolpe to treat phobias or irrational fears. For example, if a person has a fear of dogs, then he or she is asked to think about dogs, and slowly and gradually the resistance to thinking develops and the irrational fear gets suspended. The fifth technique is principle of reciprocal inhibition. So this principle says that whenever two opposing forces are introduced at the same time, then the dominant force, it is going to inhibit the weaker force. So what is actually done under this principle? The person is made to relax completely. They are relaxed on a great manner, and then they are slowly introduced to small anxiety provoking situations. Since the relaxation pattern is much greater than the anxiety provoking situation, the relaxation dominates the anxiety and the person feels calm even in the anxiety provoking situation. So this was all about the behavioral techniques, and we are done with the module of behavioral therapy. If you like the video, please like and share it, and also subscribe to my channel. Thank you.